How's it going? My name is Patrick Godinez, and I'm going to be doing an axial assessment on you today. What's your name?
I'm Riley.
Awesome. Nice to meet you.
Nice to meet you.
So for the first part of the exam, we're going to be watching how you walk. Then I'm going to feel down your spine, see if there's any pain. And then we're going to do some movements with your neck and your back. And if at any point during this examination, if there's any pain at all, just let me know. Now for this part of the exam, I'm going to see how you walk. So if you can walk to that side of the room and back. I'm going to have you face the wall so I can feel your vertebrae and the sides for your muscles. Awesome. Now I'm going to feel the sides, and I'm just looking for points of tenderness or any spasming. Good. Now you can face. We're gonna check the range of motion of your neck. So if I have you face that wall,
Okay.
and then if you start by looking up at the ceiling, and that is your cervical extension. And now if you can look down at your toes. Nice job. That's cervical flexion. Now if you can get back to normal, look regular, and then bring your look over to your right shoulder. That will be external rotation to the right. Now if you can look to your left shoulder. That will be external rotation to your left. Now if you can look straight again. And now if you can bring your right ear to your right shoulder. Right, just bring it to the side. Nice. And that is a lateral flexion to the right. Now if you bring your left ear to your left shoulder. Nice job. And that will be lateral flexion to your left. Great job. Now if I can have you touch your toes. And this is lumbar flexion. Now you can stand back up and face the camera. Now if you can reach with your left hand all the way, slide down the left side of your leg as far as possible. This is lateral flexion to the left. Nice job. Now if you do the same thing to the other side. This is lateral lumbar flexion to the right. Nice job. Then you stand back up. And now if you can face the door and lean back as far as you can as possible. Nice job. And this is lumbar extension. Nice. And have you face the wall and lift up your shirt a little bit. And I'm going to be checking your PSIS, which is your posterior superior iliac spine. Okay. Now if I have you lift up your shirt a little bit higher, and if you can bend over like the lumbar flexion, so try and touch your toes. And just checking for any abnormal curvatures of your spine, like lordosis, kyphosis, or scoliosis. But you look fine, so now you can stand up. We're going to be doing a straight leg raise, and when we do this, just let me know if you have any pain at all, but it should be a stretch. And let me know when you're good.
Alright.
Okay, nice. And right now we have you in hip flexion, your knees extended, and your foot is in dorsiflexion. Now we're going to do the other side. Let me know when you feel the stretch. Should not be any pain to stretching.
Alright.
Nice job. Good. Now if I can have you flip supine, so on your stomach. And this will be the femoral nerve stretch test. And there should be no pain with this, just a stretch. So if there's any pain at all, just let me know. But when you feel the stretch, see you're good.
Alright, good.
Cool. And right now I have you in hip extension. I have your knee in flexion and your ankle is relaxed. Nice. Can you do the other side? And have your knee in 90-degree angle. Let me know when you feel the stretch.
Alright, good.
Awesome. No pain?
No pain?
Awesome. We're going to start with the rectus abdominis.
Alright.
And its primary motion is flexing the thoracic spine. See if you can demonstrate that. So just like a basic, just like a sit-up, just sit up. Right. And that's also accompanied by the external oblique and the internal oblique. So rectus dominus is here, internal oblique is right here, and external will be right on the side. And to stretch these, you can hang off the table, if you can try and do that. So you would do it against gravity. So by simply going backwards, it'd probably be easier if you hang your feet this way.
This way?
Yeah. And then I can like hold your knees. This table's kind of awkward, but you would lay backwards and kind of just let your body relax.
Oh,
if you want
gotcha.
to show that. I got you.
I got you.
So this could also be strengthening, but in the way of stretching it, you would just relax completely. If you do it like on a bed, and it won't hurt you.
Yeah.
But that's good. Nice job. Next, we're gonna talk about the lumbar section, which is the quadratus lumborum muscle, and its primary action is lateral flexion of the spine. So if I can have you stand up, and lateral flexion is to the side, both sides. Nice. And a good way to strengthen this is you can do it against gravity. So you could like sit yourself up like on a specific machine where your feet are held down, and then you will act against gravity. So say you're hanging off the table and you're gonna go resist to the right. And that's a good way to strengthen it.
Okay.
And say you can do it standing up as well, holding like a dumbbell or something, and allow it to flex to the right. So you'll have the weight on the right, and you'll resist to the right.
Okay.
And to stretch that, you would do the opposite. So instead of going against gravity, you'll let gravity take you down. So as if you don't mind laying on the table, and laying the other way, I'm gonna have you just hang off the table a bit. And then lay on your side, and just relax and let just gravity kind of pull you down. Right, off more. Right, and your feet would be held down, and you would kind of hang off more, but you would hang completely, and it'll stretch your quadratus lumborum.
Okay.
Nice. Now, if I can have you stand up, and we're going to talk about the diaphragm and the internal and external intercostals. For your diaphragm, its main action is inspiration, so deep breath. Nice job. And that's solely on the diaphragm. And a good way to stretch this is by laying on your stomach. Good way to strengthen this. So you'll lay on your stomach and you'll just breathe. Nice deep breaths. And your body weight just pushing against your stomach. So if you can just lay on the table on your stomach. By doing this and just breathing, it already pushes your diaphragm down. So when you breathe nice deep breaths, it will add resistance against pretty much gravity and your own body weight. So strengthening your diaphragm. And to stretch this, you'll do the opposite. So you'll exhale as much as possible. So now I can have you stand up, and that also leads us into the internal and external intercostals. So for the internal intercostals, it is forced expiration, so out.
Okay.
So breathe out, breathe nice, deep breath in, and that'll be external intercostals. And when you breathe out, that's internal intercostals, which also stretches the diaphragm. And the opposite for internal and external. So when you breathe out as much as possible, it will stretch the external intercostals. And when you breathe in as much as possible, it will stretch the internal intercostals.
Okay.
Nice. Now we're going to talk about the neck muscles. So I can just have you sit right there. And we're going to talk about the scaling. Specifically, it attaches from the cervical spine all the way down to the lumbar area. And one of the neck muscles, it's going to be located right on your sides, right about here. And if you can lean on just lay on your side, because its main action is lateral flexion. So you'll rotate, you're pretty much saying like left ear to left shoulder. But lay down completely and then have your body come down more this way. Just so you're a little bit more comfortable. There you go. And then relax your arm. Relax your arm, like still hang, you're gonna hang.
Oh,
right. And then like shoulder to right. And that's the best way to work out the scaling. And then letting it stretch, you'll relax and let it hang. Let gravity take your neck down. Right. And you should feel a nice stretch. Do you feel it?
Mm-hmm.
Good.
Yep.
And then to strengthen it, you'll go against gravity. So do it, yeah, pretty good. Now moving on to the sternocleidomastoid. You're gonna sit up for this one. And these muscles are located right, go to the mastoid process and come all the way down to your clavicle. And its primary action is pretty much saying like no. Looking to the left, looking to the right. So pretty much external rotation of the neck. And a good way to stretch this is having someone passively come up to you and turning your head this way. Ow. Good. Do you feel that?
Mm-hmm.
Good.
Yep.
And then a good way to strengthen it is going against resistance. So you have bands. Bands are look kind of weird. So you'll go against gravity, lay on your side, and then say no, like pretty much say no, and then switch sides, the other side.
Okay.
Then the splinted cervicus, its main action is to extend the head. So you'll pretty much pull your head back, pretty much looking up at the ceiling. And those muscles are located right on the cervical spine, along with the semispinalis. Those are both located right in here. And they both start in the cervical and go all the way down to the lumbar. But since we're only talking about the neck, I'm going to focus on this portion. And their main actions are to extend the head. So if I can have you lay on your stomach. And since its main action is to extend the head, to stretch it, you're going to let gravity pull your head down. So if you can relax your head. And do you feel that stretch?
Mm-hmm.
Good.
Yep.
And now to strengthen these muscles, you're going to pull your head up. Good. Nice. Now, if I can have you lay on your back, and this next muscle is going to be your longest coli. And these muscles are located right in your neck. So anterior to where your cervical spine is. So instead of the back, it's on the front. And its main action is to flex the head. So can you pull your head to your chest? Good. And then relax. Let gravity take your head down. And this is perfect for stretching. Do you feel that stretch?
Mm-hmm.
Good. And then to strengthen it, you'll pretty much go against gravity and allowing your head to pull back to your chest. If you mind doing that. Good. Nice job. Now for the interspinalis. And interspinalis, its main action is extension of the vertebral column. So you'll go back on your stomach. Or you can sit up just to demonstrate the movement first. And you're going to pull your head back. Good. And that's its main action. So now, if you can lay on your stomach and allow gravity to pull your head down, this is a good way to stretch your interspinalis. And there's a lot of other muscles that fall along in this category, so it's a good way to stretch all these muscles. And going against gravity is a good way to strengthen the interspinalis. Now, for the intertransversii, its main action is lateral flexion of the trunk. So now you can sit up for this one. And its main action is pretty much going to the side. So along with the neck and the body. Good. That is its main action. So to go against this as a stretch, you'll do the opposite. You'll pretty much do the movement, but it will contract one side, so it will strengthen one side, but stretch the other. If you don't mind demonstrating that.
Okay.
So when you go to the left,
Mm-hmm.
when you go to the left, it's going to strengthen the lateral left side. When you laterally flex, it's going to stretch. It's going to contract that area, but stretch the right side, and vice versa. When you do the right side, it's going to stretch the left side. Awesome. And if you do a crunch, good. This also works your transverse abdominis. So now, if I can have you lay prone, so on your stomach, and get into a dog's pose. So when you do that crunch, it's a good way to strengthen the transverse abdominis, as well as you can relax the transverse abdominis, the rectus abdominis, and internal and external obliques. So now, if you can push up with your hands, push your hands down, and bringing your chest up, and then turning your body to the side. So turning your body to the side and bringing this leg, turning this hip as well, and really turning will really stretch out this transverse abdominis. Do you feel that?
Mm-hmm.
Cool. And then doing the other side. Do you feel that?
Mm-hmm.
Good. That's a good way to stretch your transverse abdominis. Nice job. So this is going to work on your quadratus lumborum, which are right here, and then your rectus spinae that starts from your lumbar, your iliac crest, all the way up to your cervical spine. And relax. And then do another one. Good. This is a good way to work both your rectus spinae and the quadratus lumborum. And relax. And now a good way to stretch both these muscles is going down off the table, and you can use your arms to hold yourself so you don't slam your face against the ground and just fall down more. So go down more. Keep going. Keep going. Allow yourself to let gravity stretch you back. You feel that? You can probably go a little bit more, and it'll make the stretch just a little bit more intense. And say you didn't feel this, you can now lay on your back. So now you can lay on this side now. And pull your legs to your chest. Good, nice. And then, yeah, good. Where do you feel that? You feel that in your back?
Mm-hmm.
Good.
Yeah.
Perfect. We're done with the examinations now. Now, I just want to make sure that this is okay for me to use for my class and for academic and research purposes.
Mm-hmm.
Is that okay?
That's okay.
Awesome. Thank you.